Thank you so much, Gwen. Thank everyone for being here today. And thanks Cccd for the opportunity to present on this very important topic. So we're breaking the silence. I know that this is one of those things that we are on the hush-hush about, but hopefully today we'll shed some light on it and also increase our comfort level with talking about the topic, because it really impacts our life more than any of us probably realize. Oh, hold on. Oops, wait a minute. Okay, so before we get started, this presentation is for educational purposes only. It is not medical advice, and it is not intended to replace or any of the treatments that you're receiving or to treat any condition you may have. Okay, so please consult with your healthcare provider for appropriate services. So this is for informational purposes. So if you find any of this resonates with you, please speak to your provider or find a provider who can help you with addressing it. Okay. This presentation may contain images and language that may be sensitive and triggering to some people. So I want you to be mindful of that. And if we do get to a point where it might be something that you're uncomfortable with, it's okay if you have to step away. But at least take this opportunity to, again, go out and seek more information if this is something that affects you. Okay. And there is no such thing as a silly question. I am longing and waiting for the question and answer part of this because I love answering questions. So if you have a question, if you think it's silly, that's fine. Ask it, because that means there's something you don't know. And if you don't know it, that means somebody else may not know it. And by you being brave enough to ask that question, you allow somebody else to gain knowledge. So please put your questions in the chat. No private personal stuff, but if you have a general question or if you have a question for somebody, go ahead and ask it here. If you need more information, you can contact me directly, and that's my email address below, because I really want this information to go out to the community. Okay, there is nothing you can say in regards to this topic that can embarrass me or gross me out, because I have heard it all, and if I haven't heard it all, I will at some point. And this is something I'm absolutely passionate about. So if there's anything you have to say, I'm the person you can say it to and not feel judged and not feel embarrassed about. You may not say it here, but just let me tell you that ask me anything, I am open and willing to listen to it. Also with pelvic health, it is an inclusive space. So we treat people of all races, age, gender, or sexual orientation, because we all deserve to have a healthy life and to have the best care options provided for us. Okay. And the other thing is, our whole body is beautiful. The pelvic region is an area of our body that we ignore. Sometimes we don't even look at, we've never seen. And part of this is our body's beautiful from head to toe, and it's time that we start appreciating it, and it's time that we start fully taking care of it. So let's now begin. All right, so today we're going to go through a couple of things. We're going to talk about pelvic health, why it's important, the role of physical therapy in pelvic health, pelvic floor disorders and causes, because pelvic dysfunction is multiple things, why we should talk about it, and then more than talk, why we should take action on it. And then also the importance of seeking professional help. And if we have a chance, going through some myths and misconceptions. And then the question and answer section. All right, who is this presentation for? The simple answer is everybody. Each and every one of us have a pelvis. This affects young to old. This affects male to female. This affects rich to poor. This affects fit to fat. And I like to do language in a certain way. So I put the things in front that people say, oh, this doesn't affect me. The second term is what people generally think, but it affects each and every one of us. And hopefully we'll gain some knowledge about that as we continue. Okay. And then why is this critical information for the Caribbean diaspora? The matter is, we are the most extremely affected. We are the most underserved in this area, and we are the ones that generally don't want to talk about it or are uncomfortable talking about it. Okay? In statistics, Black women have the highest mortality rate, that is, death from pregnancy, in the US. And it is not just the US, that's the only place that has the majority of statistics, but it is worldwide. Black women tend to have the highest mortality rate, and there's a significant amount of disparity in healthcare worldwide for people of color. So the second statistic is from Canada, and it says 8.9% of Black women versus 5.9% of white women have babies that are premature. So that again plays into our use of and knowledge of the medical profession, and also our access to it. The World Health Organization established in 2020 that approximately 800 women die every day from causes related to pregnancy and childbirth. And that breaks down to 1 woman dies every 2 minutes for complications related to pregnancy and childbirth. And before I go forward, for the men on the call, please don't think that this is just about women. But because of birthing, that is one of the major causes of pelvic floor dysfunction. But men also have pelvic floor dysfunction. For men, we study what's important to us. And so a lot of the studies are surrounding erectile dysfunction and what we call chronic pelvic pain syndrome, which used to be called chronic prostatitis. And so based on this study, there was a prevalence of 2 to 20% of erectile dysfunction found in men younger than the age of 50. As you get older into the 60s and 69, the prevalence went up to 20 to 40%. The concern also in this same population, you found that between 8 to 10% of these men had pelvic pain or chronic pelvic pain. And so erectile dysfunction is a pelvic dysfunction, and pain is also pelvic dysfunction. And so a lot of times you'll find these things in combination. So in terms of chronic pelvic pain for men, again, the prevalence is about 2 to 16% worldwide. And it is the most common urological disease in men under the age of 50. And then this is the scary statistic. Symptoms can be present on an average of 87 months before diagnosis. So just to get an annual physical, it's hard for men to go in. So imagine waiting 7.5 years before you can find out why you're having pain. And so this is something why we need to bring this out so people know that there is something that can be done. There is help, and also what they're experiencing is not just them. There's other people in the world experiencing it. And there should be no reason why it should take over 7 years for it to be diagnosed and treated. Another thing that we may not associate with pelvic floor dysfunction is back pain. And back pain is the leading cause of labor loss and productivity. Based on this study, over 31 million Americans are affected by back pain. And on average, there's an annual loss of $28 billion based on back pain. The second bullet point is from a study of people with pelvic floor dysfunction. And what they found is that 95.3% of the subjects who had back pain also had pelvic floor dysfunction. So again, sometimes we may not know, pelvic floor dysfunction, but everybody knows back pain. And this study is not a fully represented. This is a study of women only. But in my own experience, I now treat back pain with pelvic health approaches, because I have found a consistent relationship between people with back pain and having pelvic floor dysfunction. And then back to women, who again is my biggest client group, the lasting effects of injuries after childbearing. So they call this health problems, but really this is pelvic floor dysfunction. So again, this is from the World Health Organization. Every year, at least 40 million women are likely to experience long-term health problems caused by childbirth. More than a third of women experience lasting problems after childbirth beyond 6 weeks. So usually after you've had a child, you go to the doctor and you get a follow-up at 6 weeks to see how everything is healing. And unfortunately, again, since we don't talk about this, a lot of times we tell the doctor we're okay, even though we might be.
I want my mic not on.
It's on.
It's on. I'm I'm gonna mute you.
Please don't.
That's okay. Right.
That's good.
And so we go to the doctor, and so we may have incontinence, which is leakage, and the doctor asks us, is everything okay? And we say yes, because we think that's part of the process, that's normal, or we think it's going to go away. And so years after, I have treated patients who have been incontinent for 50 years. So you can have incontinence. And she told me, she's like, I became incontinent after my last child. So I said, when was your last child? She said, 50 years ago. So this problems can go pretty much for your lifetime after childbearing, but it really doesn't have to. All right, so of the findings in the World Health Organization study, 35% of people surveyed were having pain with sexual intercourse after childbirth. 32% were having lower back pain. 8 to 31% had urinary incontinence. So I want to stop here again and just pause. A lot of us, we think pelvic floor dysfunction is urinary incontinence, but look at the two things that come before that. So we know pelvic floor dysfunction because of leakage, but sexual pain and lower back pain have a much higher impact in some cases. There's also anal incontinence, where that's also the inability to control your anus, or what comes out of your anus in terms of stool or gas. And then secondary infertility. Now, pelvic floor dysfunction is not just a physical thing. It is also a very significant emotional component. And so this is from the same study that the slide before talked about the physical aspects. This talked about the emotional and psychological aspects. So of those 40 million women, they found that 9 to 24% had anxiety after childbirth. 11 to 17% had depression. And this is a long-term study. This isn't just after we have postpartum depression. This is long-term. This is potentially years after. And then 6 to 15% had a fear of childbirth. And again, depression and suicide is also a major concern in people who have pelvic floor dysfunctions, and especially males, because, like I said, it's in the social media, it's out there that women have pelvic floor dysfunction, but for men, they are the ones that are really suffering in silence. And unfortunately, in terms of suicide rates, men tend to be more successful when attempting suicide. And so in terms of, this is suicide ideation, the first one, there was a study that found that 23% of patients that have pelvic floor dysfunction versus 6% of controls had suicidal ideation within the 2-week period where they were surveyed. In the second one, it was 4 times increased risk of suicide attempts in people with chronic pain. And this is chronic pain in general, but the chronic pelvic pain syndrome and other pelvic pain, like I said, you could have pelvic floor dysfunction for years. So it does fall into the category of chronic after 3 months. And so you have a 4 times higher risk of suicidal attempt for people who have chronic pain. The third study I found very interesting. Again, it cannot be generalized. It's about medical students in Saudi Arabia. And they found out of 255 male medical students that were surveyed, 57.9% of them complained of chronic pelvic pain syndrome. And it can't be generalized, but again, from my practice, there are certain populations that can tend to be more at risk for pelvic floor health. And here we have high achieving, highly educated men. And so a lot of times, again, people think, oh, it's just poor, fat, inactive people. But one of the populations that have a tendency towards pelvic floor is very high achieving people, type A personality. They tend to have a more propensity towards pelvic floor health. And so that's something I just wanted to point out. So why should this matter to us? So like I said, we are the least likely to know about it or to seek care. And we are the least represented as providers in this area. So another study found that 71% of women were unaware that vaginal delivery increased risk of pelvic floor health. And I have these little asterisks around everything on here just to give me a cue to add a little bit more information. So I don't particularly agree with this when it says vaginal delivery increases risk of pelvic floor dysfunction. It is the way that we birth that increases the risk. Vaginal delivery, our bodies are designed for. Unfortunately, the way we give birth, the positions that we use, the preparation that we're given are really detrimental to the outcomes. And so just in the way that we give birth, we increase our risk of having pelvic floor dysfunction. So African American and other women of color were nearly 3 times more likely to lack knowledge about pelvic floor dysfunction. And nearly 50% of the women received no information about pelvic floor exercises or urinary incontinence during their antepartum or postpartum periods. So there were 50% of women who never have heard of pelvic floor health, who've never heard of pelvic floor dysfunction. And that is a very unfortunate thing. Okay. Now, over 40% of postpartum women have never heard of pelvic floor exercises. And then the biggest hindrance to care seeking was the belief that nothing can be done. So I also put this little reminder here, so that I should say, we all know about it. We hear about it. We talk about it. We know that it's common and we think it's normal. But just because it's common does not mean it's normal. So leaking urine is not normal. Painful sex is not normal. Erectile dysfunction is not normal. So we know it because it's common, but it is not normal. And the more important thing is there's actually something that can be done about it. Okay, so that's the ray of hope. So we have the most to gain in our overall health and quality of life and productivity in a short period of time and at very low cost, because pelvic floor health is really the simplest job I have ever done. It is just simply training people of how to use their body correctly. You know, the muscles in our pelvic floor, we now know the word pelvic floor, but we have no idea what's down there. And a lot of times people will come to me and say, I was like, oh, I've done 100 Kegels and it hasn't made a difference. And then I tested, I'm like, well, you've done 100 Kegels with the wrong muscles. So simply the knowledge of what is there, what it does, and how to use it can make a huge difference in your overall health and quality of life. All right, so based on that study as well, pelvic floor exercises proved to be inexpensive and efficient in reducing urinary incontinence, slowing the progression of pelvic organ prolapse, and can easily be implemented by patients to improve their quality of life. So there is some good news. So when I was writing the statistics, I'm like, man, there's a lot of bad stuff here, but there is some good news, and that's why we're having this conversation today. Okay, so what is pelvic health? Pelvic health involves the understanding of the function of and maintaining the health of the organs, bones, muscles, nerves of the pelvis, which play a critical role in our overall, not just physical, also mental, social, and sexual well-being. Okay, and what is this pelvic floor thing we're talking about? It's the thing that we're all sitting on right now. So the pelvic floor are the muscles that sit at the bottom of our pelvis. So if you have your camera off, you can take your hand and slide it down past your belly button until you hit your pubic bone. So they attach to the front of your pubic bone, and if you take your hand, slide it down your tailbone to the end, they attach to the back of your tailbone. And then they spread out. If you shift slightly side to side, you feel the 2 bones that we sit on. We call those our sits bones. And so the muscles spread over to the side to those. So it covers the entire opening of the bottom end of our pelvis. And one of its main functions is to hold and support all of the things above it. And so the closest things above it are, for females, our uterus, our bladder, our bowels. And that is the thing that holds everything inside of our body, basically. I have to hold on a second. Here we go. All right. And so what these muscles do, so our anal opening, our urethra, our vagina pass through these muscles. And for continence, we need to be able to contract these muscles. And so with pelvic floor dysfunction, sometimes the problem is these muscles are not contracting correctly. They're weak or they might be damaged. And so we have problems with leakage, but not only leakage, because as you see, and as I said, the muscles are attached to all aspects of our pelvis. And it also involves weight bearing, movement, stability. And so pelvic floor dysfunction affects truly our whole entire life. Now, Gwen was asking me about the difference between men and women's pelvic floor. And the truth is, it's pretty much the same with two exceptions. Women actually have two more muscles than men do, but they're generally the same muscles, and their role is to do the same thing. And then in terms of what's inside, so the picture on the right is the anatomy of the female. We have a bladder, a uterus, and our rectum. Men do not have a uterus. They have a bladder, a prostate, and a rectum. But honestly, the prostate and the uterus are pretty much the same tissue. Just as we're developing and we are dissociating into our different sexes, the tissue develops into different organs. And so the uterus and the prostate are pretty much the same material, but because male and female, the hormones, they develop into different things. And so the functions of the pelvic floor are 5 main things. Number 1 is support, like I said, to support the organs in the pelvis and also to support our body. The second is sphincteric, so those openings control the evacuation of waste, feces, and urine. And then sexual. It's for sexual pleasure, for development and birthing of children. And then stability. The pelvis is truly like the foundation of our house. If our body is the house, the pelvis is the foundation. And you need a solid foundation to make sure that everything stands correctly. And the 5th we may not be too familiar with, but it also helps with circulation. The lymphatic system, there's a lot of lymph nodes in that area, and the lymphatic system helps with drainage of the body, and the pelvic and the pelvic floor helps with drainage of the lower extremities and the abdomen, so the legs and the stomach. So what does therapy have to do with down there? Don't you guys just do massages? Now, I put that in there. I'm trying to be a little funny, but depending on where I'm at, people ask me different things because there's a different understanding of what physical therapy is. And so physical therapy, the scope of it is the branch of rehabilitation or physical medicine that focuses on restoring and improving movement, physical function. And these are things that can be affected by disease, injury, disability, and in the case of pelvic floor and a lot of things, our lifestyle. Okay. We use specialized exercises, what we call modalities, which would be massage, manual therapy, the electrical stimulation. We use different equipment and assistive devices, and then patient education and training. And again, I put an asterisk here because one of the things I try to emphasize to people is my goal really is to teach you. You live in your body. My goal is to teach you how your body works, how to use it, and how to maintain it. And so it's not about the therapist fixing you, but it's a partnership between you and the therapist in learning how your body works and how to manage it. Okay. And we do all of that without the use of drugs or surgery. Now, in the US, physical therapy presently is a doctoral degree as of 2006. And to practice, you must pass a national and state exam. You must renew your license biannually. And you must participate in continuing education and professional development. For the states that I'm licensed in, it's about between 20 to 40 hours of continuing education biannually. Okay. We also have 10 areas of specialty for physical therapy. So you have cardiovascular pulmonary, which is heart and lungs, geriatrics, orthopedics, these are terms we're familiar with, neurology, pediatric, sports, and then pelvic health. APTA, which is the Organization for Physical Therapy in the US, calls it women's health, but we are working on calling it pelvic health because, again, men have pelvises as well. And then you have the electrophysiology, oncology, and wound management. So the 5 areas that are asterisk, those are the areas that, through my profession, these are the areas that I have been interested in and developed my continuing education and knowledge around. Okay, so now what is pelvic rehabilitation? This is the study and treatment of disorders that impact the pelvic floor, the deep core, hip muscles, and tissues that support the pelvic organs, spine, pelvis, and are involved in pressure management. So here I have, again, underlined deep core and asterisk pressure management. So over here in the picture, we have this wonderful man who is completely ripped, and we're looking at that 6-pack. A lot of times when people hear core, they just think of those muscles. But deep core, you have 3 layers of muscles that support you in your core. And a lot of times you can look ripped on the outside, but be weak on the inside. And so pelvic rehabilitation focuses a lot on that deep core. And the goal is to build stability, not movement. We are constantly moving, but we seldom concentrate on stability. And so that is what we need to work on in terms of pelvic health. The other thing is pressure management. The way we breathe, the way we tense our core also affects the way we function. And a lot of times we do that very poorly. If we stop for a moment and just kind of reflect, some of us may be holding our breaths right now. And that is something that we do a lot in terms of compensation. We use our diaphragm, which is our breathing muscle, to build stability because we have a poor core. Or some people will say, it's like, oh, when I exercise, I have to hold my breath. The reason you do that is because your core is weak or you're not able to activate it properly. And so that is something that we need to look at as well. Okay, so why is this topic so important to me? So I was one of those people, I've been a therapist for 18 years, and I've heard of pelvic therapy because it's within the realm of our profession. But like many people, I thought it was an issue for old people. You know, I thought it was, oh, when you get old, your muscles get weak, you start to leak, or you sit down or stand up and you pass gas, and, you know, that's just the way it is. Until I had a child. And so I had a baby, my lovely little daughter. She's wonderful, she's beautiful. But the birth was a very traumatic experience. And I went in there thinking, it's like, oh yeah, I know what to do. You know, you just relax and you push and whatnot. And unfortunately, it was not a good experience. Because like I said, that is the problem with birthing. We're not properly prepared for it. And a lot of times the institutions that we depend on for birthing do not support us. And that might be a little bit biased, but that is quite honestly the truth. And so there was a lot of trauma that happened with my birth, which led me to pelvic floor therapy and led me to this vast knowledge of what it really is and also what can happen to you when you give birth to a child. And also, if you guys want more information and details about that, you can ask me later and we can talk about it. So if this is so important, why haven't we talked about it until now? Culturally, this is not stuff you talk about. Or if you do talk about it, it's in jokes, it's in jests, it's in lascivious calypsos and so forth. So this is not something we have ever sat down and talked about on a professional level or on a community level. And so there's a lot of lack of awareness. Okay. Thank you, Gwen. So there's a lack of awareness, and there's also a lot of embarrassment and discomfort because this is just not something we've ever talked about. You can't talk about down there. That's why I call my company Down There Physical Therapy. Because whenever somebody would come into me, they'd be like, the doctor sent me for you to look at down there. I'm like, down there where? You know, down there. And so I'm a person, I love, to have a sense of humor. And so down there, that's the majority of what we call it. We are not even comfortable. So we lack the language to even talk about what it is. And as a matter of fact, we don't really know what it is. There are so many of us who have never seen what is down there. And again, it is such an important part of our body, but yet there's this huge taboo. And a lot of times, even as grown-ups, sophisticated, educated people, we're still uncomfortable with it because growing up, it was never taught to us in a healthy way. You know, if there was any conversation about down there was often a negative connotation towards it. And so that is why now we need to start opening up, and we need to start having these conversations. And also we need to start training our children and teaching them at an early age a healthy view of what is in our pelvis and the importance of it. And a lot of it is, like I say, sometimes it's just, we haven't had the language. We haven't had the experience, and we haven't had the knowledge. And so we really now need to take this opportunity to start familiarizing ourselves with it and start addressing it in a comfortable and professional manner, so that when we have a problem, we are not shy to go to the doctor. Oh, like I said, again, you go to the doctor, everything okay? Yes, everything's fine. But you've been having pain. You've been having incontinence. You've been having constipation. But you tell the doctor everything is fine. The other problem is sometimes you say, well, I noticed something down there. You tell the doctor that. And they say, oh, okay, well, that's normal. So again, dysfunction is not normal. It is common, but it is definitely not normal. The nice thing about this time in our lives right now, we have this wonderful thing called social media. A lot of people use it for negativity, but there's also a lot of positive outcome because now there's more information available to you. So if today is the first time you've heard pelvic floor dysfunction, you could easily go to Google and type in pelvic floor dysfunction and get a world of information. The nice thing also is that we have celebrities who are speaking out on the topic. And a lot of times that's what it takes. You know, it takes somebody famous, or it takes somebody we know to say, I am having this challenge. I don't know how many of these people on this page you recognize. There are only, well, for me, I only recognize the Black people, to be honest. But these are some of the celebrities that have been speaking out about pelvic floor health and pelvic floor dysfunction. And in so allowing people to see that it's not just poor, weak, you know, it's everybody. It really is everybody. And also the other thing, stigma. It is not about you being a dirty person. It is not about anything bad you've done. It really isn't. This is something that happens to us because of the lack of knowledge of how our pelvic floor works. All right, and so one of those celebrities who I am so glad I had the opportunity to hear recently, she's speaking out, she's advocating for women's health, and her platform is menopause and perimenopause. And so even that, we talk about menopause, we have no problem with it. We talk about hot flashes, but we don't talk about the other things. And so Halle Berry was having painful intercourse, and she went to her doctor, and her doctor told her that she had the worst case of herpes he had ever seen. So this is again the thing. So unfortunately, even providers don't have the knowledge or the awareness. All Halle Berry was having was vaginal dryness. And so this is one of the reasons we also may shy away from seeking help, because imagine you go to a doctor and you say, oh, you know what, I'm having painful intercourse. And they tell you, oh, you have the worst case of herpes ever. Stigma. But like I said, we need to move beyond that. We need to move past that. And I am so glad that she is making this her platform and she's talking about it. And I wanted to share just a little clip of part of her speech and her experience.
I was at the doctor 3 days ago, and I went in to talk to him about an issue, and I said to him, you know why I'm having this issue, right? And he says, yes, I know. I said, tell me, why am I having this issue? He said, you tell me why you're having the issue. I said, no, you tell me why I'm having the issue. And we went back and forth. You tell me, you tell me, you tell me. I finally realized he wasn't going to say it. So I thought, okay, I have to do what no man can do. I have to say it. I said, I'm in menopause, okay? And that's why I'm having this issue. And he said, oh my God, I could never say that to you. Look at you, you don't look like you're in menopause. I could never say that. And if I said that to all of my female clients, they'd punch me. And again, I knew That is why I'm here doing this work, because it has to be destigmatized. The shame has to be taken out of menopause. We have to talk about this very normal part of our life that happens. Our doctors can't even say the word to us, let alone walk us through the journey of what our menopausal years look like, or our years after that, right? So when I have these moments, real moments that happen to me, I know that every other woman around this country are having these real moments as well. They're lost, they're afraid, they don't have direction, and they need help.
All right, so some of the common things that we talk about or hear about, and we don't even realize that it's a problem, are falling into these categories. So I'm going to give a couple of examples, and I want you guys to look at these categories and see if you can tell where it falls into. And also, I don't know if we have the opportunity for you to answer, but I want to know, perhaps later, if anybody can relate. They've heard this before. So, first one. I was so nervous. I almost, fill in the blank with the word that you prefer to use. Or as soon as I reach home, it's like, I'll be fine, but as soon as I reach home, as soon as I reach the door, I have to run in the bathroom one time because I can't hold my pee. Or one of our common ones, it don't make me laugh, because if I laugh too much, I will pee myself. The other thing is, all I did was bend over to pick something up. I had a piece of paper on the floor, and all I did was bend over to pick it up, and when I started to stand up, my back gave out. The other thing is, I don't go to the gynecologist because it's too painful. I don't want them to do the exam because it hurts. Or a guy may say or may not say, man, I can't get the thing up, or I can't keep the thing up. And this is a hard conversations for guys to have. They may say it in joke or jest, but erectile dysfunction is one of those things. The other thing is, like, I just have this heavy feeling in my stomach, this heavy feeling in my back. Feel like something falling out. Okay? And then this other thing is, oh, my belly hurting me. I feel so bloated. I feel my belly griping me, for some of our Southern Caribbean people. My belly griping me. I don't know the last time I went to the toilet. Can any of you relate to any of those things? Have you ever heard any of those things? So pelvic floor dysfunction is present in our life. We hear about it, we know about it, we just don't realize how serious it is. Okay, so some of those common conditions that I want to talk about today is constipation, pelvic pain, incontinence, and sexual dysfunction. And I put constipation first because constipation is actually one of my favorite topics. I love talking about constipation and treating constipation. And that might sound strange, but constipation, if that is well managed, can eliminate several other problems. So that is going to be the first thing we're going to talk about. And then here's the other thing. So I love soca, I love music. And I was listening and I realized as I became a pelvic floor therapist, I'm like, even in our music, even when we're dancing and celebrating, we talk about pelvic floor dysfunction. We may not realize it, but we're talking about it. We know about it. And so this is Crazy from Trinidad. And I realized a couple of his songs refer to constipation. So I don't know if that's a challenge that Crazy has, but there's multiple songs that he talks about it. So I wanted you guys to listen to this clip today.
Well, this is Crazy, brand new styling. Hear this? I'm a cashier, qualified cashier, working in a pharmacy. Me belly griping me. Then toilet call, I can't go up at all. So I went back to cash. Before the boss man called, they bring some X-Lax and a malt. I can't shave. Prune juice and some Epsom salts. I can't shave. They bring something called enema. I can't shave. A pack of dry leaves called senna. I can't shave. Oi, I can't shave. I can't shave. Hey, I can't shave. I can't shave. They bring all kind of things.
Now that has a really nice beat to it, right? So even in our celebrations, there's a whole song. This man sang a whole song about, he's not cashing things, he's not a cashier. He's really saying he cannot have a bowel movement. His whole entire song is about that. And here is the list. I went through that song. There is a list of 30 items that he point out that he tried to use to allow himself to have a bowel movement. So is this normal? Or is this a problem? Okay, this is a problem. And I am not familiar with everything on this list. There were also some things he said that I'm not Trinidadian, so I don't know if I got it right or wrong. But some of these things are valid, and some of them, lamp oil. I mean, we do some things. We really do some. And again, when you're constipated, it is such a horrible feeling that you really would try anything. And so he says something wrapped up in a foil. He don't even know what it is, but he was willing to take it. And so this is a major problem. And so if anybody is dealing with constipation, please know it is not normal. And the other thing, so again, 30 items to try to have a bowel movement. Constant use of laxatives is not healthy for you. And the more you use laxatives, the more difficult it becomes for you to have a bowel movement, because you're constantly irritating the bowel and it becomes inflamed and less functional. So if you do have issues with chronic constipation, please, you need to reach out to me or reach out to a provider that is available to you to learn how to manage it. Okay, so constipation, I really want to give a definition because we all have different ideas. It is a condition that makes it difficult for us to pass stool or result in infrequent bowel movements. Okay, so what does it look like? Hard, dry, lumpy, or pellet-like stools, and less than three bowel movements a week. And again, this is an asterisk because there are some people culturally who feel like they have to have a bowel movement every day. And so there are some people who would use laxatives on a regular basis to achieve this daily bowel movement because for them it's a concept of hygiene. And so medically, and it is established that if you're having at least 3 bowel movements a week, you are within normal. And so this need or desire to have bowel movements daily by force is not necessary. However, if it has been a week since you've had a bowel movement, then that is a major concern. So the next thing is when you're constipated, you tend to force, push, and strain. Now, when people come to me and I tell them, when you have a bowel movement, you should actually just sit there and it should come out, they think I'm absolutely crazy. When you're having a bowel movement, your muscles, your pelvic floor muscles are actually relaxing. And so there really shouldn't be a need for pushing or straining. And here's the major problem with this. If you are constantly pushing and straining for years, you're pushing on those muscles. Like I said, the pelvic floor muscles are attached to the bottom of your pelvis. And when you're having a bowel movement, you're pushing downward. And so constantly pushing downwards, you're stretching and weakening those muscles, which set you up for more problems. So constipation can lead to incontinence issues. Constipation can contribute to back pain issues. And so that is why I always address constipation first. And the other thing why I love it is it's such an easy thing to manage once you know what you need to do in most cases. And then, as I mentioned before, constant use of chemical stimulants to create bowel movements ends up causing more dysfunction because you irritate the bowel, and you scar it. And so eventually you get to the point where you're no longer able to use chemicals and you might have to use manual means of emptying the bowels, and nobody wants to get there. Okay, so constipation for our little kiddos, this is actually one of the major things in terms of pelvic health for kiddos. And so this Bristol stool scale shows us examples of what stool looks like. So take a moment and look at this and see if you could identify what your stool generally looks like. So in the case of type 1 and type 2, those are examples of what constipation looks like. We consider 3 and 4 to be normal, and then 5, 6, and 7 are tending towards diarrhea. And something I wanted to point out, sometimes people go between constipation and diarrhea, and a lot of times that's an indication of irritable bowel syndrome. Okay. And so if you have the tendencies, like sometimes you're constipated, sometimes you have diarrhea, you might want to look into the possibility of having irritable bowel syndrome. Okay. So what are some of the causes of constipation? And one of the major causes of disease in general right now is an unhealthy diet. If we would eat healthily, we would fix most of the problems, the medical problems that we are experiencing and actually dying from at this point in our history. And so avoiding packaged foods, dairy, red meat, and refined foods can be very helpful in also decreasing constipation. So eating healthy foods, and again, some of us may already have medical restrictions or other restrictions, but a diet that is rich in fruits, vegetables, whole grains, healthy fats and oils, and foods from nature or as close to nature as possible is the best option for you, because that is what our bodies are designed for. See, our bodies are not designed for packaged refined food. When we were roaming on the savannah, as they say it, we used to eat very hard food, very fibrous food, and so our intestines have developed and have the expectation of the need for that fiber so that we could create a stool and so that things can pass through our intestines so that we can have a healthy and frequent bowel movement. The other thing is dehydration. Many of us do not drink enough water, and in many cases I hear this, oh, I don't like water, it don't taste good, or it don't have no taste. And so again, our bodies are designed for water. The other thing I want to mention at this point, a lot of the things we drink can also irritate our bowels and our bladder. A lot of soda, acidic juices, coffee, things with caffeine, chocolate, a lot of these things actually can cause pelvic floor dysfunction. And so our bodies are designed for water. And Gwen and I had this conversation a little bit earlier. Most people don't get the required or expected amount of water. And so if you don't drink water, I strongly encourage you to start drinking water. And I put in here, drink water and mind your business. And minding your business means taking care of yourself. And so water is one of those key things that we really need to pay attention to in our diet. The other thing is lack of physical activity. There's an old Vinci calypso that says, don't eat and lie down. And so physical activity also helps with constipation, because with the movement of our body and the contraction of our muscles, we actually help to support our digestive tract as it goes along. And so it's important to get regular physical activity to avoid weakness and also to avoid weight gain. Now, also, we try to fix one problem, sometimes we can create another, and medications can also contribute to constipation. This doesn't mean you stop taking your medications. This is just knowledge to make you aware that if you're having issues with constipation and you're also taking these medications, there might be a relationship. And so it might be something you want to discuss with your provider to make sure that you're not robbing Peter to pay Paul, meaning you're doing one thing but causing problem elsewhere. Then diseases such as diabetes, kidney disease, and as I mentioned, irritable bowel syndrome can cause constipation. And then hormonal diseases such as hypothyroidism, that's where you have low thyroid. And then neurological diseases such as Parkinson's, multiple sclerosis, stroke, and spinal cord injury. These can all affect the motility, the movement of your bowels. And so these are things that can cause constipation. The other thing, again, people look at me like I'm crazy, but this is some of the stuff you find out from pelvic health. We don't really have good potty mechanics, meaning the way we sit on the toilet is not optimal for us to actually have a bowel movement. So I remember when I was little and we used to go to school, the toilets were very low. And now we start having comfort height and we start having raised and elevated toilet seats, which put us in a more seated, like you're at a table position, whereas your pelvic floor and your bowels are more easily released if you're in a squatting type position. So one of the things that have come into play to help with that is these little toilet stools. You don't have to go out and buy a fancy toilet stool. You could have a box or something in your bathroom But the key thing is you need to have your legs supported. So you don't want to be on a toilet with your legs hanging, because if your legs are hanging, your core or your trunk has to support it. So you're going to create tension when really you're trying to create relaxation. You need your knees above your hips. Ideally, the angle is 35 degrees, but nobody's really going to measure that. So we need our knees above our hips. You also want your back straight. You want everything to be nicely aligned. And then I have here position 1 or 2. So depending on what you're doing, this position is good for both urination and defecation. So there's a little trick. If you want to urinate, you lean forward slightly. And the reason you do that, can they see my screen, Gwen?
Yes.
Okay. So if you're sitting, so this is the sits bone that I talked about earlier.
I don't see that.
You can't see it?
I can see you with that.
Okay, you can see
Yes.
it. Okay.
Yeah.
So, like I said, the little points on our bottom, these are our sits bones. And so the front part, where we have our urethra, is angled upwards. The back part, where our anus is angled backwards. And so for position 1, if you lean slightly forward, you actually bias yourself to have a more easy passage for urination. If you position yourself slightly backwards, you open up the back of the pelvic floor to allow relaxation of your anus to have a nice, easy bowel movement. And the other thing is, you want to take nice, deep, relaxing breaths in and out, not There should be no straining in having a bowel movement. Just let it go. I add in there mutapu. That is one of the things, one of the techniques we use in terms of teaching people how to have a bowel movement. And again, my life and my profession is very strange, but if you make the sound moo, I know, you're in the bathroom, you're by yourself, nobody will hear you. It actually creates the right kind of pressure in your core to allow your pelvic floor to relax so that you can have a bowel movement. All right, so actionable steps for constipation. You need to eat a whole food diet. Drink lots of water, between 32 to 64 ounces a day. If you have any medical restrictions, please go based off of what your provider says. But in general, if there are no restrictions, you want to make sure you have a good intake of water. CDC recommends at least 30 minutes of moderate activity daily. And that, again, doesn't mean you have to go to the gym. Taking a nice little walk for 30 minutes briskly is considered moderate physical activity. And then I put in here, I guess these little old calypsos. Cent, 5 cent, 10 cent, dollar. Dancing. Dancing is a wonderful activity that gets you that cardiovascular activity. And also, since we like to walk up, we are actually using our core muscles. You know, as we get older and stiffer, I don't know if we realize, that's when we start having back pain. That's when we start having hip pain, because we don't have that flexibility and motion in our pelvis anymore. This thing is really important. We need to keep it lubricated and moving. And so dancing is a good way to do it. The cent, 5 cent, 10 cent dollars is a good way, because you're doing flexion, extension, side bending. If you do nothing else, put that song on a couple of times and do that exercise. And you would actually help to strengthen your core and your pelvic floor. Now, also with the medications, consult with your healthcare provider. Prevent or manage comorbidities. So if you have diabetes, if you have irritable bowels, learn how to manage these things. Again, we really tend to ignore, and I keep dropping these things in because I would talk to people and they're like, oh yeah, they say I have diabetes. Or the other thing is, we wait until we see major symptoms. Healthcare should be preventative, not corrective or really trying a last-ditch effort to save you. We wait too late. We have this habit of putting things off. And then, when I can't feel my leg, or when they say, we have to cut your leg off now because of diabetes, that's when we start to do things. So really, healthcare really should be preventative. So we need to learn as much as possible. If we have a condition, or if we're prone to a condition, we need to learn up front what to do to prevent and slow that down. And then also, like I said, good potty mechanics and breathing when we're on the toilet can help with constipation and help having a healthy pelvic floor. So, now, the other major thing that people don't realize is pelvic pain. These are all terms of different types of conditions. It's a small area. It is amazing that this tiny area can have so many different things happening to it. So vulvodynia is pain just specifically in the labia. So that's in the lips of the vagina. Vestibulodynia, that is pain in just the opening of the vagina. And the reason you can have such focal pain is because there's so many nerves in this area, because it's a highly sensitive area for good reason. And so sometimes you might feel, oh, so let me give you another anecdote. I know someone, I was going to say I have a patient, but patient confidentiality. I know someone who has been treated for UTIs for multiple years, for more than 10 years, chronic UTI. This person, when they're tested, let's say
Nadia, can you define what UTI is?
UTI, so urinary tract infection. So infection or urinary tract infection. So that could be, you might have a burning sensation when you urinate, or you might have a burning pain in your bladder. So more than 10 years, they've been told that they have a UTI, and they've been on antibiotics every time this UTI happens. But when they're tested, let's say 1 out of 10 tests is positive, so the other 9 are negative. And so, like I said, these two conditions, they're very small areas, and sometimes one of these conditions can be misdiagnosed as a UTI. So if you are in this category where you constantly are being diagnosed with a UTI, but when you are tested, the tests are negative, there's no bacterial present, but they're constantly giving you medication, this might be something you need to look into. It might be a pelvic floor dysfunction. All right, so the next one, vaginismus. That's a very interesting condition because it has a very psychological component to it. So vaginismus is where the muscles in the vagina, they go into spasm, they tighten, and they do not allow penetration. And so for a lot of women, this is a condition that prevents them from having sexual intercourse. Or if they are able to have intercourse, it is extremely painful. And why I say this one is a special one, you tend to have groups that have a very religious upbringing or very restrictive upbringing, or people, again, type A personality. This is something that you find that they tend to be susceptible to, because our pelvis and our pelvic floor it's almost like a part of our brain. And so, for example, like I was saying, I was so nervous that I felt like I needed to go to the bathroom. When we have an emotional response, not only our brain responds, our pelvic floor responds. And a lot of times I give people the example, if you scare a dog, you find that the dog tucks its tail under. I don't know about other animals, but we're familiar with dogs. And the reason it does that, it is protecting the area of its body that is critical. It is protecting the area of its body where life happens. And so our pelvis talks to us in many ways. And so we have a very emotional connection with our pelvis. And so that's, again, a reason we need to start paying attention, because it tells us things. All right. So I'm not going to go over the other ones, but like I said, these are all pain syndromes that can take place in the pelvic floor. And a lot of times they're misdiagnosed. And so especially these two. So I can't say that word. So let's just call it, you want to say it, go ahead?
Yeah, interstitial.
Cystitis, right? I have a hard time saying that word, but that's also bladder pain. And then the chronic prostatitis. So this for men is where they're being told that their prostate is infected or their prostate is inflamed. Same thing, they're tested. This is the condition that is diagnosed after 7.5 years based on the statistics that we saw earlier. Because you go into the doctor, he's like, oh, I have a pain. They're like, oh, you have an infection. Antibiotics. You go back again, oh, I have a pain. So they keep diagnosing it as prostatitis, which it's not. It's caused by either tightness, muscle pain, or other dysfunctions happening in the pelvic floor. And so these are conditions that can become chronic because they're often misdiagnosed. And so, like I said, back pain, in the absence of having like an accident or something, a lot of back pain is because of muscle dysfunction or poor body mechanics, and also pelvic floor dysfunction. Same thing with abdominal pain, hip pain, and then neck, thoracic, so that's in the spine, the ribs there, shoulder and elbow. I have treated patients who have had all of these pains, but it came back to their pelvic floor. Once we really got into it, it came all the way back to that foundation. And so I have treated neck pain with pelvic floor exercises. And so again, this is why I'm saying this is so important, and I'm so passionate about this because I didn't know this. And once I found out and once I knew it, I was like, okay, everybody else needs to know it as well. All right, so the star of the show, incontinence, which is the thing most people know about. It is the inability to control the flow of urine from the bladder or the escape of stool or gas from the rectum. And so people might say, oh, well, passing gas is not a problem. Sometimes you may move from a certain position to another and you might accidentally pass gas. Or for some people, you might stand up and pass gas. And if you're in my presence, I'm going to educate you, because what that is an indication that you don't know how to manage pressure through your body. And so passing gas uncontrollably means you're not able to control your pelvic floor muscles, which means you're not controlling your back muscles well, you're not controlling your hip or your stomach muscles well, because they all work together to help you with stability. And so incontinence is one of the big things that we hear about all the time in regards to pelvic floor dysfunction. And there are lots of different kinds of incontinence. So stress incontinence is where we have that pressure problem. We're not able to manage pressure. So this is where you say, okay, well, when I jump, when I run, when I stand up, when I sneeze, when I cough, when I laugh, I leak. That is stress incontinence. Urgency and frequency is like, as soon as I feel like I have to pee, I have to go, or else I will leak. Or I feel like I go to the bathroom all the time. Or I have to wake up multiple times at night to go to the bathroom. And so, by the way, getting up more than twice a night to go to the bathroom is an indication of frequency. Or as the example I gave earlier is like, I'll be fine, and as soon as I get to my door, I feel like I have to go to the bathroom. That's another form of urgency. Now, overflow is where you hold for such a long time that your bladder eventually just gives up and starts leaking. And so again, there are certain populations that are susceptible to this. Nurses would be one of them, teachers, people who work in environments where they're not allowed to go to the bathroom, or that productivity is such a high issue that they defer going to the bathroom and they try to hold. And so eventually their bladders give up. They literally just give up and leak. So for men, the post-prostatectomy, once you've had a prostate surgery, so there are two muscles that help you with continence. And when you have a prostate surgery, one of them is so close to the prostate that it is often removed or damaged. And so that can also lead to urine leakage. And again, for the men out there, if you are facing challenges with prostate, I would strongly recommend that you seek out pelvic floor therapy before a prostate surgery or procedure, because like I said, there are two muscles in there, but you don't know you don't know how to activate either one of them. And so unfortunately, a lot of times men go and they have a prostate surgery and they end up with incontinence, and then they come to pelvic floor therapy, and it's harder to train them because they've already had damage done, and there is no connection. There's no connection between their brain and the muscles. And so it's a lot harder to train you to do something that you never knew how to do before. And so if you are in the stages of having prostate surgery or any sort of radiation or so forth, I strongly recommend that you see a pelvic floor therapy or learn about pelvic floor exercises so that you are aware of the activation of those muscles, so that you have a faster recovery after you have the surgery. And then same thing for fecal incontinence. So you could have urge or you could have passive. So passive is when, again, you just leak. There's no sensation. You leak feces in this case. And this goes back to constipation as well. Because if you're constipated, there is hard stool in your colon, and a lot of time that colon distends, it gets larger. And so when your body produces new material, it finds its way around the hard material and it leaks out. And you don't get that urge, because how defecation works is, as the bowel moves towards the rectum, there's a signal that you get. So when you start having that feeling, it's like, oh yeah, I have to go to the bathroom. You don't get that feeling anymore, because the constipated stool is not moving down for you to trigger that feeling. And so the softer stool just moves around that constipated stool and leaks out. So again, very important things. And if it's happening to you, you're not the only one. There's no shame in it. And now that you know, really try to seek the care that can help you to improve your quality of life. So causes of incontinence are weak pelvic floor muscles, often due to childbirth. And as I mentioned earlier, it is not childbirth itself that is a problem, but really how we're birthing. And then the aging and deconditioning, the accusation of getting old, that when you get old, you get pelvic floor dysfunction. That is not the truth, because my inspiration right now are people who are in their 70s and 80s. Physical activity, if you are physically active and you eat well, you have a much higher chance of having a healthy older life. Our problem is, or again, back to culture and belief, we feel like, oh, when you get to a certain age, you're supposed to just sit down and I have no idea what. Just sit down and do nothing. But people are becoming more and more active in their older age, and they are showing that healthy diet, healthy lifestyle can actually give you much better outcomes and quality of life. So it is not aging itself. It is the things we do or the things we don't do that really affect us over the long term. And then, of course, surgery or injury can also cause incontinence. Now, here's another one. Lorraine?
I'm going to mute her.
Okay. So here's another one. So tight pelvic floor muscles. So as a pelvic floor therapist, we can work internally. So we can assess the muscles internally or externally. And a lot of times when I have clients, I say, oh, this is really tight. And they smile. They're like, oh, really? I'm like, oh, no, that's not a good thing. Because again, when we talk about sexuality, we're like, oh, we want the muscles to be nice and tight and have a grip. But when I say tight, I mean that the muscle is in spasm or shortened. And so it's actually not functional. And so one of the examples I show or tell people, for example, your neck. If your neck muscles are tight, it's not a pleasant feeling. You can't move your neck. You're restricted. And so it's the same thing with the pelvic muscles. If they're tight, they're not functioning. So they're not closing for incontinence, or they're not contracting for when you're having intercourse. The other thing that could be, so overactivity. So one of the things also that I want everybody to be aware of, and what I tell patients, we go on YouTube and we learn how to do Kegels. Yes, I want my pelvic floor to be strong, so I'm going to do Kegels. A lot of us have tight pelvic floor muscles. And so we go in and we're doing Kegels and we're just making it tighter and tighter and actually creating more problems. So this is why I say it's very important that you actually engage with a professional, because sometimes a little bit of knowledge can be dangerous if you try to use it on your own. And so if you have a tight pelvic floor and you go and do exercises to tighten it even more, you're actually causing more challenges to your system. So other causes of incontinence are, again, neurological diseases like multiple sclerosis, Parkinson's, stroke, and spinal cord injuries. And we go back again. So diabetes, high blood pressure, those are some of the things that our community suffers from greatly. And again, these are things that can be controlled with lifestyle. So our habits are the things really that are killing us. So it is not our genetics, it is not our history, it is really our habits, how we eat, how we manage stress, how we move, the kind of activities we take part in. These are really the things that are causing our demise. And so these are the things we need to really pay attention to and learn about more. Same thing now. So incontinence can also be caused by medications. And again, I have a little asterisk here by diuretics. So that's water pills. So I keep jumping in because these are encounters that I've had with people, and so I want to share that with you. There's some people who say, oh, well, I don't take those because they make me go to the bathroom, or if I take those, it limits what I can do. You are prescribed diuretics for a reason. And so pelvic floor therapy is not apart from medicine. We work with whatever other medical interventions that are taking place. And so if you have a condition where you need water pills, so for example, you might have a heart condition, you might have poor circulation, and that's the other thing, like sometimes you might go to your provider and they say, okay, well, you have a heart condition, you have circulation issues, you need to take this water pill. But you fail to mention to them, oh, well, I don't want to take it because it makes me want to go to the bathroom. And so you say, okay, you take the pills home, but then you never take them. And so your condition can actually worsen because of that. But also for you out there who are providers, if you have patients that are taking water pills because of heart conditions or circulation issues, ask them the question, do you have any issues with controlling your bladder? Will taking this medication affect you in any way? So it's also important for providers to be aware of this so that they have better compliance from their patients with taking medications. So muscle relaxers are also a problem, and blood pressure medications, because some blood pressure medications act as water pills as well, or it has an effect where it causes urination. Just one moment, please. All right, we're nearing the end. Thank you guys for sticking with me. So sexual dysfunction, another topic that we have such a hard time, a hard challenge with. But again, I want you guys to know, and I say guys because most of these conditions on here are about men. I want you guys and ladies to know that there is help for these things. So we know erectile dysfunction, that's the inability or difficulty of maintaining an erection. Premature ejaculation, that's another thing. Sometimes people think, oh, that I just come fast. Yeah. That is actually sometimes a sign of weakness in your pelvic floor. Because again, the muscles, as I showed you, the muscles that surround the base of the penis, if those are weak, it is very hard for you to control your erection or to control your ejaculation. And ejaculation is an issue where there is no ejaculate. The muscles again. So orgasm and ejaculation, pelvic floor muscles are contracting to create tension, right? And so anejaculation is where there is no ejaculation taking place because there might not be enough strength for the muscles to contract and create that propulsion needed for ejaculation. And my asterisk again, painful ejaculation, something that guys don't like to talk about. And anywhere there's an asterisk, there's a story. So there are actually, men have such a hard time admitting vulnerability. And the most manly thing is, of course, sex in our culture. And so to admit to having a painful ejaculation is a challenge. And so sometimes you have issues in relationships where couples will fight, or they'll break up, or they become abusive because the man is actually avoiding having intimacy with his partner because it's painful for him. But he's not going to say that. Right? Or sometimes dyspareunia, this is the next one. So that one is painful intercourse. So this could be vaginal or anal intercourse. Sometimes people have painful intercourse for years. I have had patients come to me and say, I have been having painful sex for over 20 years. And they live with it. It's not that it is pleasurable for them, but again, sometimes to create that bond, they engage in painful intercourse to help support their relationship. But it really doesn't have to be that way. There really is things, or are things that can be done to help this, and I have been very successful in allowing people to return to a pleasurable sexual activity because pelvic therapy is really effective. And then vaginismus comes back up again because, like I said, it's a muscle spasm issue, but also it's very painful. And so for people who have vaginismus, it does cause a lot of shame in some cases. I am not even capable of fulfilling my wifely duties. I am not a woman. So there's a lot of emotional pain that comes with sexual dysfunction, and there's not just the physicality of it, there's the emotional aspect of it, and there's the social aspect of it. But again, there is help for each and every single one of these conditions. So another curious condition, persistent genital arousal disorder. That's one that I've recently learned about, and probably you guys have never heard about. And this plays into also social stigma. This condition is a condition where somebody becomes aroused frequently and unwillingly, that their genitals is overstimulated. So if this is present in a man, you might find a man having unwanted erections. Or for women, you might have unwanted arousal and lubrication. And so this can also be very embarrassing. But if you don't know that this is a condition, you might think, oh my God, what kind of person am I? Why am I always thinking about sex? Whereas it's not your mind, it's just your body is triggered in a way that it is stimulated without the desire to be stimulated. So if any of you have any concerns or have had an experience like that, this is something you might need to look into to learn a little bit more about. And then I put my little note down here that sex is important to us. We pretend that it's not, or some of us deny ourselves engagement in sex because of, like I say, taboo, pain, or other issues. But sex is important to us because without sex, our species will not survive. And for intimate relationships, it is the thing that bonds us together. It is the thing that separates relationship from friendship. Because you can have a friend that you can talk to and go out with and blah, 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 blah. But intimacy is with your partner. And that is the one thing that makes engagement such a special thing, because you have that intimate bond with that partner that you don't have with anybody else. All right, so some couple of things. I know we're going kind of long, so I don't want to stay much longer, but pelvic organ prolapse. So there are a couple of conditions I'm just going to run over quickly. This is where you might have the bladder, the uterus, or the rectum itself collapsing or falling down or falling out of the body, literally falling out of the body. You might also have abdominal hernias, and this is where the intestines or other tissues start pushing through the abdominal wall, or in this case down here where you have a inguinal hernia, you may have heard of inguinal hernias or femoral hernias, where they push through the tissue that separates the abdomen from the pelvic region. And then we've all heard about herniated disc, and one of my also favorite conditions, hemorrhoid. And the thing that all four of these conditions have in common is pressure. So as I talked about before, you might stand up and you might release gas. So when we don't have good control of pressure in our abdomen, we can cause downward pressure or outward pressure that can lead to hernias, hemorrhoids, and even prolapse. So as I was mentioning before, constipation is one of those things that can actually trigger prolapse, because as you're constantly forcing downwards, you're also pushing on the other organs in the pelvic floor. And so pressure management is also a very important thing that people need to learn, and that's all about how you use your body and the body mechanics. Okay, so we're almost at the end. Thank you guys for sticking with me. So some of those major causes of pelvic floor dysfunction are childbearing, pressure management, so like chronic coughing. So that's the other thing, smoking. So smokers cough, that is actually something that can cause pelvic floor dysfunction. So again, if you're a smoker, really try to look into ways of ceasing smoking, because lung cancer and all those things are part of the problem, but also you can create pelvic floor problems because of it. So constipation, obesity, habits, poor body mechanics, and then physiological conditions can all lead to pelvic floor dysfunction. And like I said, I'm going to wrap up because there is so much more I could talk about, but we don't have all night, and I really want to see what questions you guys have. So what does physical therapy do in terms of treating pelvic floor dysfunction? The number one thing is what I'm doing now, education. Because the more you learn, the more you know, the more comfortable you can become. And for some cases, a lot of times when people come to me. The first time, we spend the whole time talking because there's so much that they have to learn because they don't know. So learning about the anatomy and the function and the habits in your life that can cause these things. A lot of times people come back to me the second visit and they say, oh, I feel so much better. Because simply knowing can really empower you. In terms of interventions, we have physical interventions. And as I mentioned earlier, physical therapists that are pelvic floor therapists can work internally, that's through the vagina or through the anus, so we can work on the muscles internally, or externally, specifically on the pelvic floor muscles, or abdomen, hip, back muscles, all that are related to pelvic floor conditions. And then, of course, learning the proper exercises and movements to help your body function correctly. And also interdisciplinary care. So like I said, for some of these, there is a psychological component that weighs heavily on people. There's also dietitians that they might need and other medical interventions they need. So we do work with other providers so that you have a team approach. And that's what I mentioned about holistic care. There's no one pill that fixes everything. There's no one answer that fixes everything. We do have to look at a person in a whole and holistically, meaning you may have to have multiple interventions. Okay. So what is the importance of seeking professional help? We provide education and training. We personalize treatment specifically for you. So like I said, Dr. Google and YouTube, they have lots of information, but if you don't know specifically what you need, you might actually cause more harm than good. Okay. It can decrease the risk of further dysfunction, and you have an advocate who is willing to advocate for you and your well-being. You feel more comfortable to be yourself and to ask questions, and you feel empowered and in a better control of your body. That's it. So thank you guys so much for sticking with me. I hope it wasn't too long, but I really appreciate the opportunity to share this with you today, and I really am looking forward to whatever questions you have.